Good morning, good afternoon, or good evening, depending on where you are. It's my pleasure to present this lecture today. I would like to thank for the opportunity to present a Latin American perspective on the COVID-19 vaccine situation in the Latin American region. COVID-19 has reached the world globally as an unprecedented public health emergency, and Latin America has been severely hit by COVID-19 with rapid spread of the disease. The region has shown a dramatic high mortality rate and shortage of supplies. The contingency has also reached various socioeconomic dimensions and presented itself as more than a purely sanitary crisis. In addition, Latin America also faced unfavorable political polarization and substantial diplomatic and financial struggles to gain access to vaccines. The first cases in Latin America were reported in Brazil and Mexico in February 2020. Latin American countries like Argentina, Brazil, Chile, Colombia, Mexico, and Peru ranking among the nations with the largest number of cases and deaths resulting from the disease. 3 Latin American countries, Brazil, Mexico, and Peru, rank amongst the countries with higher numbers of deaths due to COVID-19 worldwide. The circulation of the BA.5 subvariant of Omicron recently emerged is already responsible for most cases in the region. The region is currently experiencing a surge in COVID-19 cases driven by this subvariant, with the higher numbers of cases reported in Brazil and Chile and the highest number of new deaths in Brazil. While most people in the rich countries were fully immunized, a large number of people in the Americas have yet to receive a single vaccine shot. It is estimated that the 27 richest countries in the world, with only 10% of the world populations, have administered more than a third of the vaccine doses available worldwide. These disparities are also seen in the Americas, where almost people fully vaccinated in the region live. The COVID-19 pandemic has highlighted the extent of which the current model of vaccine manufacturing and distribution is highly concentrated geographically, making supply vulnerable in many countries. Worldwide, those countries with early vaccine rollout largely mirror those with vaccine production capacity. Latin America relies heavily on imported COVID-19 vaccines, having the second lowest level of domestic supplies after Africa. Specifically in Brazil, the capability for self-sufficient domestic vaccine production has allowed public laboratories to locally produce the main strategic vaccines for the country. Vaccination progress in Latin America varies from one country to the other and faces different challenges, while transmission levels remain high. And the challenges are regarding production, access, storage, and distribution. COVID-19 vaccine rollout and expansion had substantial delays in the region compared to North America and European countries. Despite this, Latin America vaccinated over 70% of its population with the primary regimen. Nevertheless, the vaccination situation is not homogeneous within the region and shows gaps, as you can see in this map, between countries and within countries. To reinforce the immune protection against the fast spread of SARS-CoV-2, Latin American countries began to introduce booster shots in their immunization programs, aiming to strengthen people's immune response against new contagious COVID-19 variants. Chile and Uruguay were leading on booster shots relative to its population. Nevertheless, many Latin American countries with positive results for the initial regimen are now lagging behind. As the number of cases and deaths waned, restrictions have been lifted and life started to look like before the pandemic. After an initial peak, the number of doses administered is decreasing over time. In addition, different COVID-19 vaccines were used in Latin America. In some countries, a substantial proportion of doses administered were of Sinovac, a vaccine that originally presented a 50% efficacy level. The combination of low efficacy vaccine to the original strain, short duration of immunity, and decreased efficacy of vaccine against new strains indicate that COVID-19 is a problem far from its end in Latin America. I will now turn to the Brazilian case. Brazil is the most populated country in Latin America and reached branching records during the COVID-19 pandemic. The country has the 5th world largest number of confirmed COVID-19 cases and ranks 2nd worldwide in the number of COVID-19 related deaths, despite representing only 2.7% of the world population, about 5 and 10% of all COVID-19 cases and deaths respectively occurred in Brazil. With one of the largest universal free of charge public health systems in the world, Brazil had a distinguished track record of vaccinations and disease control. The Brazilian National Immunization Program, coordinated by the Ministry of Health in cooperation with the state and municipal health department, is a major strength of our health system. When it comes to COVID-19 vaccination, however, the situation was very different. Constant delays in supplies and vaccine importation, as well as problems in national production and non-approval of other vaccines, impaired an adequate vaccine rollout in the country. Brazil has been facing a brutal anti-science environment, major cuts in research resources, and during the entire pandemic, a failure of the federal government to adopt evidence-based and reliable public health measures. Additionally, there was a continuous spread of fake news aiming to negatively affect the population's credibility in science and public health measures. All those factors contributed to the dramatic numbers of COVID-19 in the country. After its rollout in the country, vaccination accelerated and Brazil surpassed 80% of the adult population fully vaccinated with the initial regimen. But now, as observed in other countries, vaccination slowed down and stabilized. In addition, only about half of the Brazilian population received a booster dose. The scenario is most concerning when it comes to children. Only half of children aged 5 to 11 years was fully vaccinated, and vaccination coverage is minimal among those aged 3 to 4 years. Sadly, decreased vaccination uptake is occurring not only for COVID-19, but also for other preventable diseases. The reduction of vaccination coverage rates in recent years cannot be attributed to a single cause, but rather to multiple factors such as vaccine hesitancy, fake news, especially via social networks, on harms of vaccines for health, partial shortages of some products, and operational problems. Given the successes of the Brazilian immunization program, many diseases became unknown to the general population, so that some people have no idea of the danger they represent, which results in the risk of reintroduction or recrudescence of diseases that had been controlled or eradicated in the country. Vaccination had been decreasing in the last years, and the situation got worse with the impact of the COVID-19 pandemic. In the last 2 years, vaccine coverage, as you can see in this slide, are below the 70% goal for almost all diseases. This new phenomenon emerged not only in Brazil, but in various Latin American countries, all of them falling short of the targets for vaccination coverage rates, especially since 2016. Consequently, dwindling vaccination rates leave countries susceptible to polio and other preventable diseases. The Americas, the first global region to wipe out polio near 30 years ago, have already witnessed the disease in the US and Venezuela. The challenge of the COVID-19 pandemic adds to the decreased vaccination coverage in Latin America. As Omicron becomes more prominent worldwide and recombinant variants emerge, research efforts to prevent and control the disease continue to progress. The response to COVID-19 pandemic, as well as to other vaccine-preventable diseases, requires a global effort towards the common good. Thank you very much for your attention.